Well, erectile dysfunction only affects much older men.
Yeah, it's great question. So erectile dysfunction, I'm just going to give you the whole Coles note, right? Yeah. So ED, we kind of, this is sort of how we preface it. 40% of men over 40, 50% of men over 50, you can keep going, 60, et cetera. Sure. So why does it happen as men get older? And a lot of it probably has to do with as men get older, they're more likely to have other medical problems, right? So maybe diabetes, maybe high blood pressure, cholesterol issues, those sort of things. But erectile dysfunction is largely, there's a few components to it, but it's largely a blood flow issue. So if you're having other conditions that are potentially causing blood flow issues, it's also causing problems to the penis, right? Yeah. And so that's why erectile dysfunction actually is an early warning sign of heart disease, okay? So, a paper that we just published a couple of weeks ago, looking at actually Manitoba population, was that patients who had erectile dysfunction had a higher risk of having a future cardiac issue. Okay, and the reason why is because the blood that supplies the heart, same blood that supplies the penis, except the vessels are smaller. So if you're starting having issues with your blood vessels, it's going to happen to the smaller organs first. So your erections might be getting worse over time. Now, to go back to your question, does that an older man issue? No, it's certainly going to affect younger guys, right? But that's where we're not thinking more of a blood flow issue. Maybe we're thinking more of a psychogenic issue. So I usually tell patients when we think about what goes into an erection, I think about the blood flow, right? So there are tests we can do to look at the blood flow to the penis. It's called the penile Doppler. We can look to see the blood, if it's going in properly, are the veins clamping down properly. Hormonal, right? You want to make sure you have adequate testosterone to supply. You don't need skyrocket testosterone. You need very little, but just making sure your testosterone's in the normal range. Gotcha. Nerves, right? You need to get the nerves firing to get the penis to work. There's no real test to look at the nerves, but that's where the history comes in, right? So maybe an older man has had prostate cancer. We remove the prostate. You could damage the nerves there. You may have issues with erections after, right? So we're thinking about those components. Think about the pelvic floor. So the pelvic floor muscles, they're really responsible for peeing, ejaculation, going to the bathroom, but also really keeping that penis and the structure supported. So the pelvic floor is important. But then, the other component is just psychogenic, right? Yeah. You need to get that working as well. I have patients that say, when I'm having intercourse, I lose my erection. And then when I ask them, what about masturbation? Like, oh, that's fine, right? But just trying to create those links. Like, okay, well, why are you having problems there? Why are you not having problems there? Is it because of a stimulation issue? Are you just not having the same level of stimulation during intercourse that you are masturbation? Yeah. And that's what's keeping you erect? So younger patients, we certainly think more psychogenic than I think a truly blood flow issue. It's very rare to have an organic or a physical cause for erectile dysfunction in a younger patient. But there's a big conversation in there to kind of really try to figure it out.
I think it's great that you mentioned the psychogenic aspect of ED. Is that even now a lot of users, I think they're relating to the pornography, right? A lot of young males are coming out with addictions to pornography and how that influences your performance in the bedroom. It's do you think that's correlated, or is that I guess the question put it in the question is, do you think pornography has a direct effect to ED?
Yeah, I mean, like anything else, is porn bad? No, it's all moderation, right? But what can it cause? Well, number one, you may have a complex, right? Just be like, my penis does not look like that, right? So number one, you're already starting to feel, right? Yeah. You're already comparing, right? So you're like,
I hate when that happens.
Yeah, yeah, exactly. Right away, you're like, man, that sucks, right? So you're already one concerned about your penis leg. Yeah. You're like, why is that guy, I've been on break for an hour and that guy's still going, right? You're like, how is this possible, right? So you're already concerned about premature ejaculation. So you got two things already off your, right? Yeah. So I think that's where porn can have some issues, right? When you're comparing yourself. And when you have really no porn, what kind of group of guys are sitting around talking about how quickly they, ejaculated, right?
Every week.
Yeah.
It's the weekend.
So I think it kind of definitely leads to some problems in that sense. Certainly, number of patients I talk about is that they'll always talk about premature ejaculation. Yeah. As soon as we actually talk about the numbers in the minutes, I'm like, you're well in the normal range. Yeah. But they don't know because there's nothing to compare it to. What are we thinking about penis size? Most people are in the normal range, but every single human being is going to think they have a small penis, right? So I think the pornography aspect is going to be the moderation, but when we come back to that stimulation, I think that what pornography can do, or especially with masturbation, is that you may not be replicating that during intercourse, right? Because it's not uncommon for patients to say, "I'm not feeling it during intercourse," and so that's where we have to sound about, okay, why? Like, what's going on? Is it because of masturbation, positioning? So all these sort of things come up. And that's the one nice thing about the clinic, is that patients feel comfortable when they come here. They can have that conversation.
Yeah.
I think the one trouble is, especially with erectile dysfunction, as soon as you Google ED, you're getting so many ads on Facebook for getting pills shipped to your door.
Yeah.
Like discreet delivery, this. Oh, don't worry about it. Just order online. So, but it's saying discreet delivery for a condition that's so common that we should be talking about and trying to figure out the root cause, as opposed to just trying out a pill, right?